Good evening, everybody. Thank you for joining us today. My name is Jennifer Slonaker, nurse practitioner from the Mayo Clinic Headache Division, and I'm joined by my colleague.
Hi, I'm Natasha Mendez, and I'm also a nurse practitioner at Mayo Clinic in the Headache Division.
Today, we are going to discuss with you the treatment of chronic migraine with the use of Botox injections, also known as OnabotulinumtoxinA. And we will give you a brief overview about Botox and its treatment, and then we'll open it up to questions.
All right, perfect. So some statistics about migraine. 36 million people in the United States currently have migraine. Of those 36 million, 3.2 million people are living with chronic migraine. Many people go untreated or are treated ineffectively.
So Botox is just one of the treatments that we can use for chronic migraine. Today's discussion is focusing on that. So Botox was approved in 2010 by the FDA for the treatment and prevention of chronic migraine. We think that the way it works is by blocking the pain signals that originate in the central nervous system that travel to the head and the neck, hence preventing pain. It is made by a highly purified protein of the botulinum toxin. And then it is reconstituted with saline and mixed with saline prior to the injections.
Botox was approved by the FDA in 2010 after a very large clinical trial was conducted. Currently, over 2 million treatments have been given.
Looks like we've been joined by some folks. I have a couple of questions here. Do we see any changes coming as to the cost of Botox? At this time, we cannot comment on the cost. We know that a majority of the insurance companies do cover Botox as a treatment. And I'm not sure if you're aware, but there is an excellent savings plan. And if you were to go to the Allergan website, you can see what they offer in terms of monetary assistance that can go towards your deductible.
Yes, currently they're offering $400 towards out-of-pocket cost if you have commercial insurance to pay towards the treatment for chronic migraine.
We have another question. It says, does it really help? We have seen many of our patients benefit from Botox in conjunction with other therapies that they receive. It would depend on the individual patient and what other treatments they were receiving. But yes, we have seen Botox to be quite effective in our practice. We have another question. Could they stop working? I have been getting them for 18 months and I feel like they are not working as well. Sometimes it is possible. So again, it really depends on how many units of Botox you are receiving over how long of a time and what the interval is. There is a possibility of reducing the interval of the treatments from 12 weeks, which is what the PREEM trial paradigm tells us to do, to maybe a frequency of 10 weeks. And there's also a possibility of increasing the dosage from the standard 155 units all the way up to 195 units.
And it's also important, Jennifer commented on that as well. You can go up to 195 units, but also making sure that you're getting your treatment cycles exactly at 12 weeks apart. A lot of times we see patients fall behind on their treatment cycles and they may go to 13 weeks, 15 weeks behind. And once you prolong your treatments, the Botox can become less effective. So making your appointment when you're done with your Botox for your next scheduled appointment is really important. So they're exactly 12 weeks apart.
So another question. It's been working after 8 weeks, which is strange because it's supposed to start helping after 2 weeks. Have you heard of this before? So do you want to take this one?
Yeah. So the studies show that Botox can actually start working as early as 4 weeks. But according to the clinical trials that were done, the results can take as long as 24 weeks. So if you're starting off with Botox initially, you want to do at least 2 full rounds of Botox. But we do recommend that you do 3 rounds. The evidence has just showed that if you do 3 full rounds of Botox, you have a better chance of being a responder to Botox, but people can see results as early as 4 weeks. After having completed the 3 rounds of Botox, it's expected that you can have a reduction in your headache days by 8 to 9 days per month.
Okay, so the next question is, can the location vary? Does it matter if the location varies? So yes, so there are, this would be a good time to talk about the locations. So per the pre-am protocol, the injections have been shown to be most effective when they are placed in these particular locations. We can actually show you on our model here. So the injections should be placed in the little areas where there are red dots. So the procerus, which is the dot right in the middle, then the other 2 injections in the corrugator muscles, the other 2 spots, then in the frontalis, 4 injections across the top of the forehead, then the temporalis muscles on the side, then on the back. We've got the occipitalis on both sides and the cervical paraspinals right below that. And then 3 injections on each side on the trapezius muscles. So yes, it is extremely important that all the major muscle groups that we just talked about are covered in your injections.
And that totals 155 units, and those are the key muscles that were studied in the clinical trials to have significant benefit for chronic migraine.
Yes, so the total of 31 injections. So the next one is, have there been any studies on Botox and hemiplegic migraine? So yes, Botox can be used to treat hemiplegic migraine as well, as long as it's a chronic migraine.
And just so you know, the procedure is done in the office setting, and it takes about 15 minutes to complete.
Correct. And there was a question about side effects, and we'll go over those. So just some of the most common side effects of Botox: about 9% increase in neck pain, which is the most common side effect, about 4 to 5% increase in headache and migraine, which is transient, so it does go away. There is a cosmetic side effect, about 4%, which is ptosis, a droopy eyelid or a droopy brow, which is completely reversible and will go away once the Botox wears off in about 12 weeks.
There was a question, explain why Botox works on those sites. Those specific sites were the sites that were studied initially during the clinical trials that brought the Botox to get its FDA approval in 2010, which is the 155 units. Additionally, some providers will go up to as much as 200 units, which there were additional studies that have been done, which we call the follow the pain approach. And those sites can be anywhere additionally on the head that some providers do. There was a question about who should not get Botox.
Okay, I can cover that one. So some of the reasons why a person may not be able to get Botox: first of all, there is eligibility criteria that has to be met for chronic migraine, which means you must have at least 15 headache days per month, 8 of which you do get a migraine type headache lasting at least 4 hours in duration. Outside of that, some insurance companies require that you try at least 2 preventative type medications before we can receive approval to try Botox on that patient. And then some reasons why a person cannot get Botox would be if they have an infection at the sites where we would be injecting, if they have pre-existing conditions such as difficulty breathing or a neuromuscular disorder such as ALS or myasthenia gravis, or if they have an allergic reaction to Botox or Botox-like products. Also, if they have pre-existing health conditions such as difficulty breathing or swallowing, or at this time, Botox has not been studied on pregnant women, and it has not been studied on nursing mothers, so we would not be injecting those particular patient populations. We have another question.
There is a question if Botox stops migraines. That's a good question. For every patient, it's different. Some patients have a reduction in their headache days. Some patients have a reduction in the severity of their headaches. Some patients completely get rid of their migraines and don't have any. Some patients will still have migraines, but maybe we'll only have 3 or 4 a month. Some still have 8 or 9 a month. So it just varies depending on the patient.
We have a question from Kristen. She says she's had 2 sessions with no relief. Would it be worth trying a 3rd one? Absolutely. We encourage patients to try at least 3 distinct, adequately spaced sessions of Botox before you decide if it's worked for you or not, because it can take up to that 3 whole cycles sometimes to see the response.
Let's see, there's a question about you, patients had they've been sore and achy for a week after receiving Botox, and this can happen. Just generalized soreness, increase in headaches, increase in migraine. That is a side effect at 4 and 5%, like Jennifer discussed earlier. We recommend just talking with your headache provider if this does happen to you, but it is a known side effect that people sometimes do not feel well after receiving Botox, but it is transient and it does go away.
So next question is from Megan. What happens when Botox doesn't help? Again, I would encourage you to talk to your headache provider to first see if there's any room in improvement in Botox in terms of increasing the units or making it more frequent. And if that still is not helpful, then I would look at other medications and nerve blocks and other options to see if those are beneficial. The next one is about the date piercing. It's nothing to do with Botox, but we don't have any evidence that date piercings work in prevention of migraine.
The next one is says they had a reduction in the days after their first 2 rounds, but their headaches increased after their 3rd round. They're not sure if they should proceed with their 4th round. I would discuss it with your headache provider, but if I had a patient that asked me about that, I would say they should at least try one more time. There could have been some circumstances going on that they just had an increase in their headaches. I don't know what you would say, Jen.
Yeah, no, I agree completely. Mm-hmm. Okay, next question. Both times I did Botox, I had injection site pain and the whole time with no reduction in migraine. Have you heard of that? The doc said she hasn't heard of that. So injection site pain is actually quite common, and that can be reduced by application of ice before the injection. You can also apply EMLA cream, which is a topical lidocaine preparation to reduce injection site pain. The next one is, again, about injection site pain in the face. Yeah, so same answer. Should you take Tylenol prior? You may take Tylenol. It is a bit challenging if you take blood thinning type medications such as aspirin or ibuprofen because it causes more bleeding. But Tylenol is completely okay to take. Next one is, whether they inject the Botox. Where do they inject the Botox? We covered that a little bit ago. But there are 7 key muscle groups that we inject the Botox in. We can go over that again if there are other people that are joining, so we can show where we inject.
Sure.
So let me just turn my camera around. So the sites again, procerus right in the middle, corrugators on the sides, frontalis muscles across the forehead, 4 injections on the temporalis muscle on the sides, and on the back of the head on both sides, we've got the occipitalis muscles. Then right below that, the cervical paraspinal muscles. And then on the shoulders, we have 3 injections on each side, which is the trapezius muscles. I think we missed.
We missed a question.
Can you repeat the other one? I think it's the Emla cream that you're referring to. So it's a topical lidocaine ointment that you can apply 30 minutes prior to the injection to help reduce the discomfort. There's a question about Fioricet. So Fioricet, again, not something we're discussing today, but I can briefly say that it has been shown to cause medication overuse headaches, so it should be used in very limited quantities when other options are not available. We're just scanning to see if we missed any other questions. I think we covered all of those.
Mm-hmm. Did we answer this one?
No, so we did not. Does Botox, this one? So it's just tinnitus and photophobia.
Oh, no, I was talking about that one. Yeah, but yeah, we can answer that one.
Okay, so in terms of photophobia, if you have an overall reduction in migraine with the use of Botox, then yes, the photophobia should also be reduced.
Mm-hmm.
And should we scroll down? See?
Yep.
Does Botox affect your neck range of motion at all? So if the cervical paraspinal muscles are injected improperly, or if more units than the recommended dosage is used, then you may experience some neck weakness.
There's a question about neurostimulators. No contraindications that I'm aware of with neurostimulators and Botox?
No.
No.
Next one is, what do I do to be prepared for the doctor's visit for the Botox? Well, we always like it if the patients are mentally prepared, because especially if it's their first time, it can be a little anxiety provoking, and ask lots of questions and make sure that you feel comfortable before proceeding.
Yep.
So let's see, Tina says Botox saved her life. I'm so glad to hear that, Tina. A lot of relief. Still a lot of discomfort and nagging neurological issues that made day-to-day activities unbearable. Okay, that's great to hear, Tina. Glad you're doing better.
Wonderful. So again, just to let people know, 97% of commercial plans are paying now for Botox for chronic migraine as long as you meet the criteria. And there is a Botox savings card for out-of-pocket cost if you go out to the website for on Allergan's website for the Botox. You can sign up to be a part of their savings program.
And there's a request to explain one more time how Botox works. So Botox is a medication that is made from purified protein of the botulinum toxin, and it works by blocking the pain signals that originate in the central nervous system going to the head and neck. And I believe don't have any more questions at this time. So we thank everybody for joining us, and we encourage all of you to speak with your headache provider if Botox is something that you are considering or if you have further questions.
Thank you so much for joining in.